So in terms of our adult clinical trial, it is an upfront ketogenic diet trial. That means that when the patient is diagnosed, they come out of surgery, the diagnosis is done by the pathologist, and we try to get them started as soon as possible. Like our dietitian, Leonora Renda, meets with them while they're still in the hospital. In terms of how far we've come with it, not as far as I would like, and with all of the other people doing trials that I spoke to, we all seem to be in the same boat. We don't have a lot of survival data yet. We know it is absolutely tolerable. We know that there are no major adverse events. In other words, we know there's no reason not to do it. In terms of the reasons to do it, it's so variable. And I think we just don't know the best way to do it. That's really what I think. Tumors are very heterogeneous. What that basically means is if you look at 10 cells, you've got 10 different genetic backgrounds. If you look at patients with a glioblastoma, they actually can be subset into different molecular subtypes, sort of. It's possible that the diet will behave differently with different molecular background in these tumors. We don't know that yet. What we need to do is not just take these trials for whether there's adverse effects or not. We know there aren't, but at this point. But to the extent we can, add all of the things that the personalized medicine people are doing. Personalized medicine is not fulfilling its promise, probably because the different cells in the tumor don't all have the same targets that you target. But all the cells in the tumor have metabolic damage. So you can affect these cells with metabolism. You can make them weaker, which makes everything else work better. But we don't know the best way. We don't know what is it about tumor A where the patient actually responds to the diet well, and tumor B with the same diagnosis where they don't respond as well. So you need the funding to do these trials when you're talking about a lot of these molecular things, metabolomics, epigenetic analyses. And funding like that very often comes from pharmaceutical companies. They can't invest in this because they can't make money back from it. They've got stockholders, you know, they can't do that. So I think we're at the beginning of a journey that is going to be unbelievably exciting, but it's at its infancy. There's just so much we need to know. And that's, I think, frustrating and exciting at the same time.